Working at UC means being part of a unique institution and a vibrant community of more than 190,000 employees. As the world's leading public research university, we educate California's youth, expand the boundaries of knowledge, train tomorrow's leaders, treat the sick, and help solve some of the world's most pressing problems. In addition to our 10 campuses, we operate 5 world-class medical centers, 3 national labs, and countless programs up and down the state. We're also one of the largest employers in California. Arguably, no other single institution does as much for so many. It's our people who make UC great. Every faculty and staff member, no matter what their individual job, plays an important role in the UC community. We work hard to be a good employer and to make UC a place where people enjoy what they do and are rewarded for their contributions. We offer outstanding health and retirement benefits for you and your family, opportunities to advance your career, and the chance to make a difference alongside some of the brightest, most visionary thinkers of our time. This presentation will give you an overview of the benefits of working here. But it's just a summary. For details about UC's benefits and your options, spend some time looking at your welcome kit or visiting our employee website, UCNet. And make sure you enroll for health benefits within 31 days and choose a retirement plan option within 90 days, starting with your first day of work.
Good health and welfare benefits are among the many rewards of working at UC. They're comprehensive to give you a range of choices, and they're portable within UC too. So if you move within the UC system, they move with you. They're also a valuable part of your total compensation. Bundled together, your benefits represent as much as 40% of your total annual compensation, depending on your position. So who's eligible for UC benefits? The answer is most everyone. The scope of your benefits, meaning the type and number of choices you have, depends on a few factors, like how many hours you work, the length of your employment, and the type of position you hold. We cover you and your family, including your spouse or domestic partner, and children up to the age of 26. Even if someone, you or a dependent, has a pre-existing condition, it doesn't matter. You're still covered. UC offers 3 categories of benefits: full, mid-level, and core. Here's an overview of each. You're eligible for full benefits if you're part of a UC-sponsored retirement plan. That means you're appointed to work at least 50% time for 12 months or more, or working a certain number of hours in a 12-month period. With full benefits, you get to choose among all the benefits available to UC employees: multiple medical plans, a choice of dental plans, and a vision plan too. Disability and life insurance help protect you, and tax savings programs help you save money. If your position is eligible, you may have mid-level benefits if you work at least 50% during a year but aren't part of a UC-sponsored retirement plan, or if you work 100% for at least 3 months but less than a year. Mid-level benefits give you access to a choice of medical plans and most UC voluntary insurance and savings programs. Finally, depending on your position and the number of hours you work, if you don't qualify for full or mid-level, you may be eligible for core benefits, which give you access to some essential benefits, including medical insurance and life insurance, both paid by UC. One final point. If your UC position is represented by a union, the terms of your pension and health benefits are subject to collective bargaining and governed by your union's contract with UC. As a result, your benefits may be somewhat different than the ones outlined here.
Regardless of your benefit level and plan, UC makes medical coverage as accessible and affordable as possible. Here's a closer look at the plans you can choose from. If you're eligible for full or mid-level benefits, you have a number of choices. You can select from a variety of plans, including HMOs and PPOs, as well as a premium-free catastrophic plan. In most areas of California, there are HMOs where you get services from a custom network of doctors, hospitals, and other providers. With an HMO, your costs are predictable. You don't have deductibles. Instead, there are small copays for office visits, and some services have no charge. UC Care is a preferred provider organization, or PPO, designed specifically for UC that allows you to use the services of any doctor or hospital. You pay a percentage of the cost of services, and in-network providers cost less than out-of-network providers. Plus, there's a network that includes UC Medical Center providers and facilities. You pay a copayment for most services when you use these providers. There is also a high-deductible PPO with a Health Savings Account, or HSA. UC contributes to the HSA, and you can too, plus contributions are tax-free. You pay the full cost of services until you meet the deductible. Then you pay coinsurance, and in-network services cost less. You can use your HSA to pay your deductible, out-of-pocket costs, or any other approved medical expenses, including dental or vision expenses. You own the HSA, so even if you change to another medical plan later, you can still use any balance to pay future medical expenses. Last, there is a high-deductible catastrophic plan. All UC medical plans, without exception, provide high-quality, comprehensive coverage for your medical, pharmacy, and mental health needs. We also offer the UC Living Well program that combines activities at your campus with services from your health plan to help you and your family live well and stay well too. If you're wondering how much you'll pay for these benefits, the simple answer is, it depends on your salary and the choices you make. However, on average, UC pays about 85% of medical plan premiums. To choose the plan that's right for you, you need to go over your options, determine your budget, and consider your needs. If you're eligible for full benefits, you'll also have a choice of 2 dental plans and vision insurance, and UC currently pays the entire premium for these plans. Along with medical, dental, and vision insurance, UC offers eligible employees many other types of insurance. Some of them the university provides automatically at no cost to you, and for some of them you must enroll. You have the option to pay for additional insurance, which will provide you and your family important protection. UC also offers flexible spending accounts, or FSAs, tax savings programs that give you a smart way to pay for things like childcare and health expenses that you probably have to pay for anyway. Only instead of paying after taxes have been taken out of your paycheck, you pay before taxes. That lowers your taxable income when you have to file your annual tax return. Less money in your paycheck now adds up to a lot of savings later. Eligible UC employees enjoy a lot of other benefits too, including all sorts of leave provisions, access to other types of insurance and services, and all the privileges that come with being part of our community. These may differ depending on where you work. Talk to the person who handles your benefits for more information.
While your health and welfare benefits take care of you and your family now, your retirement benefits help you prepare for the future. Planning for retirement is one of the biggest financial responsibilities you'll face. UC offers both primary retirement benefits and voluntary pre- and after-tax savings programs, along with a variety of educational tools and resources, including personal retirement counseling. Your retirement benefits vary depending on when you were hired or become eligible for these benefits. If you were hired on or after July 1, 2016, you have a choice between 2 primary retirement benefit options: pension choice or savings choice. You have up to 90 days from the date you become eligible to choose a primary retirement benefit option. This is usually your hire date. If no choice is made, you'll automatically be enrolled in pension choice at the end of the 90-day period. The amount of your compensation that counts toward your retirement benefits is determined by a few factors. Retirement benefits are based on eligible pay, which does not include certain types of compensation. For a list of types of compensation that are not considered for retirement benefits, see the complete guide to UC retirement benefits on UCNet. The IRS sets a dollar maximum on annual earnings that can count toward total retirement benefits. This maximum is reviewed and may be adjusted annually. Separately, the maximum earnings that can count toward pension benefits is consistent with the maximum on pensionable earnings allowed under the California Public Employees Pension Reform Act, PEPRA for short. This maximum applies to other California public pension plans and is also reviewed and may be adjusted annually. For certain employees, the PEPRA maximum may not apply. If you are rehired after having previously worked for UC in an eligible appointment, If you start work at UC before July 1, 2016 in an ineligible position, but become eligible for full retirement benefits after that date, or if you were a classic member under CalPERS and are eligible for reciprocity. If you're in one of these groups, or if you have questions, please contact the UC Retirement Administration Service Center, or RASC. Now, let's take a closer look at your two options: pension choice and savings choice. Pension choice includes a pension benefit under the UC Retirement Plan, UCRP for short, along with a supplemental 401k style account for some employees. Pension benefits provide a predictable level of lifetime retirement income and are based on age, UCRP service credit, and eligible pay up to the PEPRA maximum if it applies to you. You will vest in or be eligible to receive your pension benefits after 5 years service credit as soon as you satisfy the age requirement. Along with providing retirement income for you, your pension benefits can also provide retirement income for your survivors and disability income if you become totally and permanently disabled before retirement. Along with the pension benefit, designated faculty and some other eligible academic appointees and staff can build retirement savings through a 401k-style supplemental account. This is a portable retirement plan account you can take with you if you leave UC, draw from in retirement, or leave to your beneficiaries. Both you and UC share the cost of your retirement benefits. Your mandatory contributions are a percentage of your eligible pay up to a maximum set by the IRS. UC's contributions to the pension benefit are a percentage of your eligible pay up to the PEPRA maximum. UC's contributions to the supplemental account vary by employee group. For designated faculty, UC's contributions to the supplemental account are a percentage of all eligible pay up to the IRS maximum. For other academic appointees and staff, UC's contributions are a percentage of eligible pay above the PEPRA maximum up to the IRS maximum. UC's contributions to your supplemental account are yours after 5 years service credit. Your personal contributions are always yours. The timing of distributions from your supplemental account is subject to plan requirements. Savings choice works like a 401k plan. In this option, your mandatory pre-tax contributions, plus contributions from UC, accumulate in a retirement account. You manage the investments in your account, selecting from a menu of available funds. Your retirement income will depend on how much you and UC contribute and on the performance of the investments you select. You can draw from your savings choice account in retirement or take the vested benefits with you if you leave UC. The timing of distributions from your savings choice account is subject to plan requirements. Savings choice does not include disability or survivor benefits, but money you don't take out can be left to your beneficiaries. Employee-paid disability coverage is also available. Both you and UC contribute a percentage of your eligible pay toward your retirement savings up to the IRS maximum. UC's contributions are yours 1 year from your eligibility date. Your personal contributions always belong to you. If you decide to participate in Savings Choice, you may have an opportunity to change your participation to Pension Choice in future years. Enrollment in Pension Choice is permanent. UC is requesting IRS approval to offer employees this second choice option. Deciding which option is right for you depends on a variety of factors, including your age, the length of time you plan to work for UC, your personal financial situation, and your investing style and risk tolerance. Consider Pension Choice if you expect to work for UC for much of your career, are comfortable with UC managing a large part of your retirement assets, and want predictable retirement income payments. Consider Savings Choice if you prefer a portable retirement benefit and are comfortable choosing and managing your retirement investments. Remember, if you're new to UC, you have up to 90 days from the date you become eligible to choose a retirement option, or you'll automatically be enrolled in Pension Choice. Contributions from you and from UC begin within 1 or 2 pay periods of your enrollment.
If you were hired before July 1st, 2016, and were eligible for full retirement benefits, you were enrolled automatically in UCRP. Your UCRP benefits are not subject to the PEPRA maximum, and you are not eligible to participate in the Supplemental Savings Account or in Savings Choice. When you retire, you will receive your retirement benefits as a lifetime monthly pension. Your pension income will be based on age, years of UC service, and eligible pay, up to the maximum set by the IRS. You'll be fully eligible for pension benefits after 5 years service credit. Depending on when you were hired, you also may have the option to take your benefits as a lump sum. Your pension benefits also include the opportunity to provide retirement income for your survivors and disability income if you become totally and permanently disabled before retirement. Both you and UC contribute a percentage of your eligible pay toward the cost of your pension benefit up to the IRS maximum. In addition to your primary retirement benefits, UC also offers several voluntary plans that allow you to add to your retirement savings while taking advantage of deferred taxes. There's a tax-deferred 403B plan, a 457B deferred compensation plan, and a defined contribution plan that permits voluntary after-tax contributions, subject to IRS maximums. With these plans, you can invest in a diverse selection of UC-monitored funds as well as other investments and mutual funds. You may contribute to either the 403B or the 457B plan, or both at the same time. That means you can double the amount of your annual tax-deferred contributions by participating in both, subject to IRS maximums. Some employees who don't qualify for primary retirement benefits make mandatory pre-tax contributions to the DC plan. All eligible employees may make after-tax contributions to the DC plan, subject to IRS maximums. All of the details about your primary retirement benefits and voluntary savings programs are in the Complete Guide to UC Retirement Benefits, which you can find on UCNet.
We know there's a lot to consider, so we have tools and resources to help you make sense of it all, including our UCNet and My UC Retirement websites, your welcome kit, financial education classes, workshops, and individual financial planning and guidance. Many locations offer additional webinars and workshops to help you be a knowledgeable benefits consumer. Once you decide what you want to do, it's time to enroll. For health and welfare benefits, visit At Your Service Online or UCPath, depending on where you work. To choose your retirement benefits, go to myucretirement.com. If you're just joining UC, it's important to get started right away. New employees have exactly 31 days, starting with your first day of work, to enroll in health and welfare benefits, and up to 90 days to choose retirement benefits. If you have any questions or aren't sure what to do, ask the person who handles your benefits for help. UC is an amazing institution and a great place to work and grow. We're glad you're a part of it.